Today we're going to be reviewing the introductory anatomical terminology. Now, this is going to be a chapter you'll see right at the beginning of every introductory anatomy textbook, without a doubt. And on your first exam, of course, you will be getting these terms over and over again to make sure that you know them. However, these terms will continue through the entire course. There really is no getting away from them. So, even though it's a pretty simple introductory chapter, make sure you know these terms, because later on when you get questions on the skeletal system, you may wind up still using these terms. You may get questions such as, name the most lateral bone in the antebrachial area. So not only do you have to know that that's going to be the radius, you have to be able to also know the antebrachial area, and you're going to have to know lateral, or everything that you studied with your skeletal system is going to be a moot point. If we're going to use these terms to take out the ambiguity, so that when one person is discussing anatomy and describing something to another, they can use these terms to be remarkably specific. We want to make sure that we're using these terms in reference to a stationary, static reference point. For us, that's going to be anatomical position. So any of the directional terms, we're assuming that this is the position of the body while you're using them. Standing straight upright, feet flat on the floor, parallel, pointing forward. Head level, looking forward. Arms at the side of the body, palms facing forward. So this is going to be our static reference point to give those directional terms a reference and a meaning. We have them grouped together in pairs, so they kind of reference opposites of one another. Anterior versus posterior, superior versus inferior, medial versus lateral, proximal versus distal, and finally, superficial versus deep. When we look at anterior versus posterior, we're referencing front and back for layman's terms. Anterior meaning that the piece of anatomy that we're referencing is closer to the front of the body. Posterior meaning the piece of anatomy we're referencing is towards the rear. And we use these terms, any of those pairs, in reference to one another. So anterior and posterior, we can say that the nose is anterior to the ear. We can also just as accurately say the ear is posterior to the nose. So they're used in conjunction, referencing each other. For superior and inferior, this is where we normally see the lines. And I could have corrected this to prove my point, but I wanted to leave them as they're often shown in many textbooks. I want you to know that superior and inferior are going to be reserved when we're discussing anatomy of the head and the body, not the extremities. So in spite of where we always see this arrow drawn referencing inferior, it has nothing to do with the lower extremities. Only torso and head. Superior is going to refer to that the piece of anatomy is towards the head. Inferior being its opposite, that piece of anatomy is going to be towards the tail, if you will. So we'll only be using torso and head. So the nose is superior to the belly button. The belly button is inferior to the breastbone or the sternum. Do not use these terms for the extremities. We have other terms that you'll see in a moment that are specific for the arms and the legs. Medial versus lateral. Now for this one, we also need another static reference point, and we're going to use that mid-sagittal plane. Medial refers to a piece of anatomy that's closer to that mid-sagittal plane or the midline of the body. Lateral means that that piece of anatomy is further away from the midline. So the shoulder is lateral to the breastbone. The thumb on the right hand is lateral to the little finger on the left hand. We can say that the breastbone is medial to the elbow. The pubic symphysis of the pelvis is medial to the greater trochanter of the femur. We said earlier, superior and inferior only reserved for the torso and the head. Here's our two terms for the extremities, proximal and distal. We're going to use as a secondary reference point here the point of attachment for those extremities. So the term proximal refers to a piece of anatomy that's closer to the point of attachment. Distal means further away. So if we use the shoulder and the hip as the point of attachment for their respective extremity, the elbow is distal to the shoulder. The wrist is distal to the elbow. The Elbow is proximal to the hand, and so on. Superficial and deep, of all those pairings, these are probably the two simplest ones. Superficial meaning closer to the surface of the body, deep being its opposite, further away from the surface of the body. So we would see internal organs be referred to with deep. The skin, the integument, is obviously a superficial organ. You'll see these terms pop up mostly for your course when you're doing the musculature. We often see muscles grouped in deep versus superficial groupings. Like when you study the muscles of the neck, you will have the superficial muscles of the posterior neck, and you'll have the deep musculature of that part of the spine. But here we have our epidermis, and dermis, and subcutaneous layer as a typical diagram of the integument. The epidermis is superficial to the dermis and the subcutaneous layer, while the subcutaneous layer is deep to the dermis and the epidermis. So now that we're oriented and we have our directional terms down, we have to combine those with our regional anatomy, superficial anatomy. And we're going to break this down, starting with the head and working our way around the body. The first piece is going to be the cephalic region. That refers to the entire head, anterior and posterior. I want you to picture, if we took a human skull with the jaw, we'll have the entire cephalic region. Anything above that first cervical vertebra. Now, once we take that skull, we can subdivide it up into two halves. If we were to put a hat on, we would have the ridge of that hat going from our base of our skull at the back, just over the ear, and across above the brow. Anything above that line, we're going to consider the cranial region. And it's typically going to encompass any of those bones that make up and form part of the cranial cavity, which house the brain. Anything below that line is our facial area. And it's going to include the oral region, being the mouth, the nasal region, being the nose, the otic region, the external ear. It's going to include the buccal area, being the cheek, or the orbital area, which is the eye. The tough part on the facial bone that a lot of students forget is the mental area. You hear mental, you think brain, and now you're automatically starting to think more superior on the head. The mental area is the point of the chin, the point of the mandible. The only one we haven't discussed up here so far is the frontal region, from where the hairline should be down to the top of the brim of the eyebrows. Now, it is where the hairline should be. Someone has a receding hairline doesn't mean their frontal area continues to get large. It's going to be that line roughly where the hairline should be down to the top of the eyebrows. We leave the head and we start to go down the upper extremity, and we start with the acromial area. If you run your fingers across the top of the shoulder, you will get to a bony prominence. That bony prominence is the acromial process of the scapula. So anywhere around there at the top of the shoulder is our acromial region or acromial area. We extend our way down the arm and we get to the axilla, the armpit. This is a region that becomes obscured with the arms at its side in anatomical position. If we want to see the axillary region, we have to raise the arm so we can see the area underneath. So even though we see diagrams like this with the axillary region pointing in, it's not pointing to anything out here on the chest. It's referring to the area between the arm and the side of the torso. The brachial area is the upper arm, and it includes the entire circumference, from the anterior aspect, continuous with the back. We work our way distally, and we get to our elbow area, our antecubital being the anterior portion of it. But now when we get to the posterior aspect, we have a new term, the olecranon area. So the antecubital is the front of the elbow. The olecranon area is the rear. Right there where we get the olecranon process from the ulna, that bony prominence. We continue distally and we get to the antebrachial area. That is the entire circumference of the forearm. We continue down from there and we get to the carpal region. Now here's one that's often identified slightly incorrectly on a lot of the diagrams. The carpal region is where the carpal bones sit. So we have to move our way distally past those bony prominences of the radius and the ulna. Once we get past there, now we're actually on the wrist joint itself. That's the carpal region. You wrap your fingers around that part of the wrist, that is the carpal region. You often see it indicated more along the lines of where someone would wear their wristwatch. And of course, you don't wear your wristwatch that close to the hand, because if you did, it would obscure and become an obstacle to you being able to flex and extend the wrist. We move out distally and we get the manual area. It's only shown over here on the posterior aspect, but the manual area is the entire hand, front and back. The remaining terms referring to the hand are pieces of the manual area. So for example, we have the pollex, being the thumb, the palmar surface of the hand, and the phalanges, or the digital areas of the hand. Those are all subdivisions of a greater manual area. The dorsum of the hand would refer to just the back of the hand. Again, another part of the manual area. We look at the leg and we start with the coxal area. It's going to be the lateral aspects of the hip, almost like where someone would wear that Western six-shooter at their side. From the top of the iliac crest down and including the lateral greater trochanter area of the femur. Speaking of the femur, we move down and we get to the femoral area, the thigh. Again, the femoral area refers to the entire circumference of that thigh. We move down to the knee, and similar to what we saw with the elbow, we have different terms for the anterior versus the posterior aspects. On the anterior, we get the patellar region. On the rear, we get our popliteal region. We extend distally one more time, and we get to two terms that are often confused with students. Crural area, C-R-U-R-A-L, versus sural area, S-U-R-A-L. Aside from the point that they kind of sound similar, and someone like myself who speaks a little quickly, you may miss that little distinction. The crural area is the entire circumference of that lower leg. Anything that's going to be just distal to the patellar region and the popliteal region down to our tarsal region, which we'll get to in just a moment. The distinction between the two is that the sural region, the calf, is a part of the greater crural region. So the crural region is the entire lower leg. The sural region is just the posterior aspect of the crural region. We extend down, we already mentioned the tarsal region. It's going to be kind of where the talus is. So we move just distally to those bony prominences of the ankle, the medial and lateral malleolus, down to and including, or not including, the calcaneus. That's going to be your tarsal region. Calcaneus, only viewable from the back. It's going to be right here, that bony point of the heel. We move distally again, and we get to the pedal area, meaning foot. Of the pedal area, we have the undersurface that you stand on, the plantar region. We have the area on the other side where your shoelaces would sit, being the dorsum of the foot. And we have our phalanges of the foot, and the hallux being the great or big toe. All that's left is going to be our torso now, and we're going to start at the top. We go back to our cephalic region for a moment just as a reference. We move just off the base of that cephalic region, the base of the skull, and we're onto the cervical spine. The cervical region is the entire circumference from the base of the skull down to the C7 vertebral prominence that we draw a line straight across from, and anteriorly get to be bordered by the bilateral clavicles and the superior aspect of the sternum. The thoracic region. Now, the thoracic region can also be referred to as a region of the spine. Make sure we get the distinction that this is going to be superficial anatomy. And in this case, the thoracic region refers to the anterior portion of that rib cage. Anywhere where the ribs would sit. So we border superiorly with those clavicles again. Anything below that, all the way down to where the lower ribs would sit. So this is going to be the entire thoracic area, with a subdivision being the mammary areas, or you'll also see that called the pectoral areas as well. I guess that's more maybe a unisex term. Below the ribs, we move off the thoracic region and onto the abdominal region. Anything from those lower ribs down to a line crossing right straight across the umbilical region, the belly button. We look at the posterior aspect. The ribs on the back is going to be our dorsal area. Anything from that C7 line down to the bottom of the ribs again. Anywhere between there is going to be our dorsal region. We move below the ribs. This entire region, all the way across here, all the way down to the top of the iliac crest, if we draw a line straight across here, is our lumbar region, referencing the lumbar spine that sits right in there. If you envision this line coming across here, it's going to form a triangle. That is the sacral region, referring to the triangular-shaped sacrum that will sit right in there at the base of the spine. Inferior and lateral to the sacral region, we get our bilateral gluteal region. So that takes care of all the superficial anatomy. Again, pay a lot of attention to learning the directional terms, and it will help you as the entire course goes through. Thank you.